mode.
Good afternoon. Welcome. I'm Dr. Jill Brooks, Director of Education for First Healthcare Compliance. Here at First Healthcare Compliance, we are focused on helping healthcare providers and billing companies around the country save time and money while reducing compliance risks with our single source solution. Each month, we bring different experts in the field to discuss a variety of topics relevant to healthcare practices. We are so pleased to have Devendra Saharia and Amy Bridge from AGS Health joining us today to discuss strategies to solve the mystery of coding talent shortage in our industry, local, global, or Glocal. Devendra is the CEO and founder of AGS Health, and Amy is the Executive Director of Medical Coding. AGS Health is a global revenue cycle management company providing billing and coding solutions to healthcare providers across the country. Dev?
Yes. Uh, Thank you, Jill, and good afternoon, everyone. Thank you for this opportunity to meet with you today. As Jill outlined, my colleague Amy and I will walk you through the rest of the session today, starting off with initially discussing and laying out the context about the challenges that we all face in our HIM and revenue cycle departments due to shortage of coders. As we all know, with the imminent transition of ICD-10 happening next year, the challenges of shortage of coders becomes even more intense. What we'd like to do is take a few minutes and talk about some of the pressures and challenges we face, and then get into details and discuss what steps you can take to ensure a more successful transition to the new coding convention, and also manage the shortage of coders to tackle some of the current billing and coding challenges. I'll talk a little bit more about the challenges and possible solutions at a high level, and then Amy will lead the rest of the session and get into more details on these issues, possible solutions, and the next steps. In terms of the challenges that we all face today, we know the migration from ICD-9 to ICD-10 is a major one. We all understand that we are going to be moving from a 30-year-old coding convention, ICD-9 CM, to ICD-10 CM PCS, which is a more current and a more comprehensive coding convention for clinical practices. The biggest difference that will be there from ICD-9 to ICD-10 is just the sheer number of codes that will be introduced, and that's going to bring in more specificity and a better and more current understanding of the diagnostic and procedural activities. As a result, there are going to be new pressures on the clinicians, coders, billers, and auditors to document and code at a much higher level of detail. The results, we believe, will be a better evidence-based practice and better views into grouping and reimbursement processes. However, for all of these to happen successfully, we need qualified coders to ensure that the transition happens smoothly. As we all know, there is a huge demand-supply imbalance today in the coding world. Various studies have shown unemployment for coders running at historic lows. Normal unemployment for any group is in the 7 to 8%, according to the Labor Department. And so it's very clear to us that we are in a superheated labor market for coders. With a minimum number of coders graduating from accredited programs and older coders choosing to retire, we need to make sure that we take that extra step to keep those coders and managers we have meaningfully engaged. Also, the older coders who are retiring aren't being replaced fast enough. This means there's a lot more work for a lot fewer people. There's also additional data and statistics that indicates that nearly half of all coders currently work between 41 to 70 hours per week. The data on the slide is from the Coder Salary Survey and corroborated by Manpower Survey 2011. And it is not just the HIM department who will feel the pain of transition. Registration and patient access teams will struggle with pre-authorizations and certifications, as well as medical necessity tools. Revenue cycle, patient accounting will struggle with clean claim ratios on billings, as well as increased administrative and medical denials. Likewise, IT will be stretched to answer all of the master file and data flow glitches that are sure to occur in the many interfaces that exist in the clinical practices and hospitals. So with all of that going on, what's the solution? We believe that there is no perfect or an overnight quick solution. But there are options available which can help us alleviate many of these challenges. What we all agree today, I presume, is the solution, the right solution will be one which is quick, efficient, and compelling. And in our opinion, there are different options one can take to address the short-term challenges for the next year, year and a half. But according to us, having a more innovative approach which brings a global solution to the table will be a more effective one. A good solution will comprise of a global supply chain combined with strong and robust training and education processes that will ensure that the readiness for ICD-10 is there. On top of that, we also need to build in very strong quality and process controls to ensure that the shortage in number of coders can be managed in a manner such that we can scale and address the needs of the industry. These are some of the ideas that Amy is going to delve into more and talk about some of the different options and how each one can play out, some of the pros and cons, and how HIM and revenue cycle departments can evaluate their possible solutions and pick what is best for them. With that, I'll pass it on to Amy.
Thank you, Devendra. I wanted to first start by acknowledging a few of the challenges and needs that you're facing. Those who have experienced managing coders in the U.S. understand the ever-growing expectations of these coders. With more and more physician practices and hospitals transitioning to a fully electronic medical record, U.S.-based coders are expecting a work-from-home option with flexible schedules. This changes which we have to manage this process, and it increases challenges with regards to managing productivity expectations, managing in-house versus remote coders, and retaining coders in general. When using the local solution, you may also assume a heavy overtime cost, and considering the budgetary issues now, we need to remember to also consider an increase in this budget to be included in next year's budget as we move towards ICD-10. With the expected productivity impact, overtime costs will soar even higher. Local solutions will also require limiting vacations taken until at least spring of 2016. And I know that's probably not going to be very popular with the coders. Consider also that there will be challenges regarding additional documentation needs. In the ICD-10 environment, clinicians can't and shouldn't code anymore. With an increase in code sets from 13,000 codes to over 69,000 codes, it's just not practical for them to be the coders. Instead, physicians should focus on treatment and specified documentation. As this code set is more complex, clinicians will need to expand their documentation to allow for the best possible code selection and therefore the best reimbursement. This is also the best compliance posture and will most likely lead to the best financial outcomes for the practice as well. And to underscore the reality of the situation, I want to share the most recent OIG decisions. In the last 3 months, there were 17 decisions made for over $5.8 million in civil monetary penalties. In addition to the workloads normally seen in the clinician setting, we can also add RAC audit responses and other hospital-based duties that are not always seen in the clinical scene. Elizabeth Stewart had an excellent article in ICD-10 Staffing last year. It's a great resource to help us understand some hidden needs in this sea change event. It's very important to allocate resources now to evaluate CDI under the ICD-9 setting, and several independent studies have shown significant measurable improvement in many of these settings. A particular example showed that 88% of organizations showed significant net cash improvement where a strong CDI program had been implemented, from $50K in smaller organizations to over $1 million in the 200-plus bed hospitals per year. Strong CDI programs will be the key to successful and specified coding in ICD-10. As mentioned on the slide, there are many coding-related needs and staffing shortages, and the HIN department is not the only ones who will feel the pain of this transition. Registration and teams will struggle with pre-authorizations and certifications, as well as medical necessity tools. Patient accounting will struggle with clean claims ratios on billing, as well as increased administrative and medical denials. And likewise, IT will be stretched to answer all of the master file and data flow glitches that are sure to occur in the many interfaces that are going to exist in the clinical practices and hospitals. There's an ongoing need for backfill and vacancy coverage, increase in business volumes, quality assurance audits, ICD-10 training coverage, just to name a few. So looking ahead, there'll be an additional need for the productivity impact of the ICD-9 implementation. Estimates are that it could be as high as 30% impact for 6 up to 12 months after implementation. And the bottom line is that there needs to be a pressure release valve or cash flow is going to slow down. And one outlet for this pressure will be to outsource. So this raises the questions of what to outsource and with whom. So let's talk a little bit about some potential solutions. The local solution is heavily weighed down with some concerns that don't show any easy solution, and the marketplace sees this, and it's increasing for outsourcing solutions, either onshore, offshore, or a strategic blend of both kinds of services. And this blended approach has been given the term Glocal, representing the use of both local and onshore resources for certain coding functions and global resources for others. So the term local includes in-house coders, CDI teams, which is clinical documentation improvement teams, remote coders, and domestic coding companies with US-based coders. And the term global includes completely offshore models with coding operations located in India, Central America, UAE, Philippines, etc. And the term Glocal, as I mentioned, is a hybrid of both local and global processes. And this could be a domestic coding company that partners with an offshore vendor, or it could be a local HIM team that uses offshore for overflow coding. The options are limitless based on the particular needs of the practice or facility. And in September 2013, a comment was noted in AHIMA's online blog that virtually every U.S. outsourcing coding company, both large and small, are building their own overseas coding center or partnering with an existing center to meet the productivity demand. So the decision to outsource is not one in which you surrender all of your work or all of your responsibilities, and certainly not all of your risk. Look at the kinds of work that need to be done and determine whether and how the work can be put into separate workflows or buckets. Identify the layers of coding responsibility as well as the skill sets within the daily demands of the coding department. So here we call out the possibility of identifying a possible 3-tiered strategy where the 80-20 rule is applied. The most complex and highest reimbursement coding can be retained internally, and then subsequent layers of the coding responsibilities, either locally outsourced or fully outsourced to a global partner. So on this slide, you'll see a checklist you can use when looking for a vendor to work with. Ask yourself such questions as, who does your clinical documentation improvement now? And are they your best resource and at the right cost to deliver that service? Repeat this question for each category of coding that needs to be done. We see MS, DRG, and APC acute care coding as one group, clinician, E&M coding, and procedure coding as another. There's observation coding, which is a bit of a slippery slope due to case management concerns. There's also ED facility coding, and outpatient diagnostic is the highest quantity and possibly the lowest complexity of all the groups. Then ask yourself who currently responds to all the inquiries from outside of the department. Clinicians, doctors' offices, patient access, patient accounting, and so on. Who answers all the inquiries, and are they backlogged? Should these resources be allocated somewhere else so that your staff can do more mission-critical work such as coding? And what about the QA efforts for each level of coding? Be realistic and recognize that there are many pieces to this decision, and the outsourcing decision should have a cost factor, but if that's your only consideration, then you're going to get what you pay for. Once you've made your decision as to which portions of your work to outsource, then you have the framework for the questions to ask your potential partners. One of the first questions to research is, what is their proposed turnaround time? Will your work be billed out as timely as it currently is, or will there be a delay? The next and most important question is, what is the prospective partner's quality control process? They should be able to guarantee a 95% accuracy rate throughout their internal daily quality checks and verify through your external quality checks. You'll also want to ask how quickly they can have staff members available for you. A well-staffed vendor will have resources available within 3 to 4 weeks at a maximum, which is how long it usually takes for the IT, application access, training, etc. The next question to ask is how many FTEs the potential vendor has on board and what the ratio is of auditors versus auditors and managers, etc. There should be ample auditors to assure a minimum of 5% continuous QC and enough managers to assure adherence to all of the service level agreements. You should also ask how many of their coders are credentialed. I will say that there's currently a shortage of available test seats in India to keep up with the growing demand of credentialing coders. However, at a minimum, your offshore partner should guarantee that the coders will be audited by credentialed staff members. Next, you should ask if the coders have the skill set for the type of work that you'll be outsourcing, because not all coders are created equal. Some have specialized training on either the facility or the professional side. Some professional coders are further specialized by the type of procedure. And then lastly, ask your potential partners about their IT and security accreditations, their disaster recovery capabilities, and about their security and IT-related policies. Potential vendors should have already met the requirements of standard security accreditation. So continuing on with our checklist, IT setup should also be relatively easy for you. Potential vendors should have an IT resource that they can work with, or that can work with your IT team members to make this a seamless process. On this slide are some of the examples of the security certificate that I mentioned on the previous slide. Next, you should ask what training programs are in place. Gold standard vendors have training programs in place for all level of coders to ensure adherence to the coding guidelines and the principles. And training should cover guidelines for ICD-9, CPT, coding clinics, modifier usage, CPT assistance, etc., and they should be ongoing throughout the year. Ideally, programs should be computer-based with interactive sessions that are led by certified trainers. This assures that the coders can learn at their own pace and have plenty of practice, and also have certified trainers available to teach them and to answer any questions that come up. And I believe that quality assurance programs should start within the training session so that there's an understanding verified at every step of the coder's path. Lastly, it's important to learn if The potential vendor performs other revenue cycle management functions, whether you intend to use them for these functions or not. The best coders are those that understand how coding fits into the revenue cycle management process. And it's best if your vendor also performs charge entry, denials management, etc., so that they can proactively relate to your entire process or perform any of the components of the process which you desire. So we've discussed a little bit about possible solutions, and we've covered questions to ask yourself and potential vendors. However, you may find that there's still some opposition to moving forward with using an offshore partner. These are typical issues or concerns that an HIM or office manager will encounter when they're thinking of using global or local services. So here are some myth busters to help you in convincing others who may have some hesitancy in outsourcing. Myth number one is if you outsource, you will compromise quality for low cost. For authentic global outsource vendors, quality is a non-negotiable parameter. It's essential to the process, and it's also essential to keeping a good working relationship. If the quality review processes and training programs and quality controls are robust, then quality is guaranteed irrespective of the geographical location. For example, good companies always have a stringent quality program that ensures all coders maintain a minimum 95% accuracy rate. And reviews should be done on a pre-bill basis so there's no impact to your reimbursement. You should be able to expect high quality in addition to saving 30 to 40% on cost. Myth number two is that if you use an offshore vendor, your data will not be secure. Security and compliance are well established and well documented in successful global outsourcers. The policies should be well executed, and all staff should go through rigorous awareness sessions, periodic audits, and regular feedback. And as I mentioned previously, be sure to ask for the details and even for copies of the policies and certificates. Checks and controls have to be in place to ensure compliance is embedded in every activity while working with client confidential data and with protected health information. And coders should learn about HIPAA guidelines and data security upon hire and throughout each stage of their career. Myth number three is that global coders don't have the same level of knowledge or education. Globally based coders, particularly those in India, are some of the most qualified in the world. They are college and university graduates in life sciences. They have nursing degrees, pharmacy degrees, physical therapists, dentists, and most are trained by experienced U.S. coders and learn coding through the same resources as your coders do. Many are also certified by HEMA and AAPC. In fact, audits done by domestic audit companies have shown no lag in quality by offshore coders. Myth number four is that U.S. coders will lose their jobs. So as you can imagine, deciding to outsource can be a very political decision. As discussed earlier, unemployment for coders is nearly 0% right now, and the demand is growing at double-digit rates. And one study shows that there are only 2,000 graduates available for 10,000 jobs. I'm based out of Salt Lake City, Utah, where we currently have 60 open coding-related positions. So statistics show that there really is no fact to back this myth. Myth number five is that the time zone differences will cause delays in production, delays in communication, and basically a loss of control over your productivity. There's a term called time arbitrage, which is the use of time zone differences to your advantage. Makes the global solution even more attractive. The U.S. coders usually work 8 or 9 o'clock in the morning until 5 o'clock U.S. time, and the India coders start at around 10 p.m. Eastern time, delivering a day's work by 8 a.m. the following morning. This makes it possible to essentially have 16 to 20 hours of coding or coding services per day. Additionally, global teams in India are available real-time 4 to 6 hours every day in the morning for meetings, as the management staff usually overlap into the morning of the U.S. team's schedule. So after answering to some of the concerns surrounding the myths we've just discussed, it's important to also get buy-in from all the stakeholders. And the two most important groups to get buy-in are those most affected, which are the coders, and those who are approving the finances or purchasing, which is the C-level. So getting coders to own the process engages in their higher needs above pay issues and above workplace issues. If they can understand the staffing and production issues that need to be resolved, then they're more likely to feel comfortable with the solution of outsourcing part or all of the work. To obtain C-level buy-in, it's usually best to outline a strategy for the change. Hopefully we've given you some tidbits for that. We started this presentation addressing the changes that we're all planning for with the expected ICD-10 conversion in October of 2015. Prior to the delay of the implementation date, we all got a taste for the need of coders the closer we got to October of this year. And I can tell you that there were a lot of physician practices and hospital groups planning ahead, and because they did so, they had coders in place and training well underway and no backlogs. Many of the groups that waited until much closer to the deadline to prepare found themselves waiting in line to get coders sourced to their projects, which did cause backlogs and delays in billing. And the best advice I can give you is to plan ahead and establish a relationship with your global partners now. Test out the waters by having them do a little bit of your work during ICD-10 refresher training or backfill when you have some vacancies that need covered. This allows time to tweak the process as needed, and it also gives you time together to create your transition plan, which will include coverage during your ICD-10 training and coverage to offset the productivity impact after implementation. Prepare fully for all productivity impacts. Estimates are that the productivity impact will be 30 to 60% initially due to the learning curve of a new system, due to increased denials work and documentation queries, etc. And we also need to budget for the financial impact. There'll be an increased cost for training, additional audits to assure understanding of the new system, and overtime wages. Using a global partner to help offset these can help offset additional costs. So to sum up our conversation, a good global partner, at the very least, will be able to supply the FTEs needed for your specific projects now. They'll have a set of core values equal to your own and will manage their business by those core values. The cost associated with using an offshore partner should significantly reduce the cost you're currently spending to recruit, train, and retain your employees. And you should also expect that you will no longer have the pain point of attrition. You won't have productivity losses associated with sick or vacation time or resignation or retirement. Your outsourcing partner should manage all the staffing internally, and it should be a seamless process to you. And you should no longer have backlog work lists, which result in a loss of cash flow. So now that we've addressed the need, challenges, checklists, and myths, let's talk a minute about next steps. One of the best approaches to a successful transition is to plan ahead. If you wait until the need is upon you, the transition will be rushed. So planning ahead allows for ample time to provide training to the vendor on your specific guidelines and processes. It allows ample time for IT access setup, and it allows ample time for a ramp up during transition. The best transitions, in my experience, are those that start small and then scale up over time. And then having good policies in place in advance to share with your potential vendor become an important process map for your outsource partner and make training a much smoother process. Additionally, team members that are 100% committed to the organization's success are the deciding factor here. All of the planning in the world will not count if execution is half-hearted. Lastly, relating to the quality assurance, ensure that your department or your outsourcing partner has a clearly defined quality assurance and training function in place with the right tools, the right teachers, and the right resources. During the transition, everyone must be at their peak performance and contribution. In summary, outsourcing some components of your coding process, particularly offshore coding, is a highly valuable and profitable solution, providing that the right systems, processes, and governance structures are in place. And these are the foundation blocks for successful outsourcing relationship. Assuming these are in place, virtually every offshoring success story owes its achievement to a strong sense of partnership and mutual trust. Thank you for this opportunity to speak with you today, and should you have any questions, we've included our contact information